Hello from Anant and Pallavi. People, how you guys doing? There's something which is doing the rounds, which is called diabetes. ये नाम सुनते ही डर लगता है नहीं अनंत?
But nowadays, it's a very common thing.
Mm-hmm.
And on Meet the Expert today,
Yes.
we're going to be talking to somebody who's an expert on how to treat diabetes and also endocrine disorders.
Exactly. We've been joined on the airways with a very special guest today, consultant endocrinologist and medical director. Endocrinologist. Consultant endocrinologist and medical director at RAK Diabetes Center in Jumeirah. Well, we have Dr. Zain Gulzar with us. Dr. Gulzar, welcome to the show.
Thank you. Thank you for having me here.
So, first and foremost, how many years has it been that you've been a doctor?
Well, I graduated from medical school in 1990, so it's been a long time. I've had all my formal trainings and I started practicing endocrinology in 2000.
Mm-hmm.
So that's about 16 years. So.
Wow, that's a long time. Doctor, so let's start by talking about diabetes. A lot of people are getting it. Young people are also getting it. What exactly is diabetes?
All right, so diabetes is commonly refers to the term diabetes mellitus, which is a disease condition of glucose metabolism. Now, this is derived from the Greek word diabetes, meaning to siphon or to pass, and mellitus means honey or sweet.
Mm-hmm.
So initially this term was coined because it was found that people were passing urine that was sweet and attracted ants. Now, people who have diabetes are not able to effectively carry out the process of converting sugars into fuel energy. In the body, insulin is produced by a small part of the pancreas, and this insulin is the main chemical that the body uses to utilize glucose and produce energy. Insulin helps to allow glucose to be transferred from blood into various parts of the body, such as the liver, fat, muscles, and where other reactions take place, resulting in energy production. This is what normally should happen.
Mm-hmm.
Insufficient amounts of insulin results in incomplete transfer of glucose from blood vessels into the cells. And so the blood concentration of glucose rises, leading to high blood sugars. This is what happens in diabetes. Constant high blood sugars is toxic and poisonous to certain organs. So when the circulating blood rich in glucose reaches distant organs like eyes and kidneys, it results in damage to those organs.
We have Dr. Zain Gulzar with us. We're going to ask him more questions. A lot of people don't like taking medicines and a lot of people don't agree with medicines, or rather the medicines don't agree with them. तब क्या होता है पता करेंगे बस थोड़ी देर में.
Diagnosed even in your 30s if you are diabetic.
Yeah, so this type 2 diabetes is generally seen in people who are over the age of 20. So, someone who is 30, 35, yes, definitely. The older one is, the higher the likelihood.
In conversation with Dr. Zain Gulzar right here on SUNO 1024.
When we come back on SUNO 1024, we're going to ask him, is there a cure या जिंदगी भर दवाइयाँ खानी पड़ेंगी if one is diagnosed with diabetes? Meet the expert on SUNO 1024 with Anant and Pallavi.
Diabetes can cause low blood sugars or hypoglycemia. Most people who are on insulin would have experienced hypoglycemia at some time or another. Now, fortunately, most of the time hypoglycemia is mild and can be easily self-treated. One must be careful to recognize symptoms of hypoglycemia and to treat it early rather than wait it out. The symptoms of hypoglycemia is dizziness, sweating, irritability, poor concentration, blurry vision, headaches, and excessive hunger. And the first thing to do when one is hypoglycemic is to consume something sweet. Juices, glucose tablets, soft candy, dates, all of this can be used and should be kept handy. If blood sugar drops and one is fasting in Ramadan, then there is no alternative other than to break the fast. If this symptom, if this symptom of hypoglycemia is happening frequently, then one should see the doctors to assess the medications. Untreated hypoglycemia or severe hypoglycemia can be very dangerous and can lead to loss of consciousness and coma.
In conversation with Dr. Zain Gulzar. Doctor, we were talking about diabetes and the fact that medication is required. Do these medicines have any side effects? What if a patient doesn't feel well while taking these medications? What if a patient doesn't feel well while taking these medications? Do they have a lot of side effects?
So all medications have side effects, some more than others. Low blood sugars or hypoglycemia and weight gain are the most common side effects. Some of the newer medications do not have these side effects. Other medications can cause abdominal bloating, constipation, or diarrhea. But overall, diabetes medications are generally safe when taken as prescribed. Diabetes that is untreated has far more side effects than the existing treatments available. Now, if one does not feel well on the medications prescribed, then I would recommend that person should see their doctor and let them know. Often one may feel side effects that are temporary. Sometimes these result from high doses of medications which can easily be adjusted by lowering the dose. Some of these side effects are transient and will go away after a few days. And there are lots of medications available. So if one does not suit a person, then always that can be switched to another type of medication. It is generally not a good idea to just stop taking the medication without informing the doctor.
On SUNO 1024, Anant and Pallavi all the way with you on a nice Saturday morning. Dr. Zain Gulzar is here, of course, to talk about diabetes. And doctor, we were just talking about, the symptoms. How can one tell if one has diabetes or not? It's scary.
So, a simple blood test that is done early morning fasting is a very quick and cheap way to detect this. So a fasting early morning blood test is one of the easiest tests that can be done. However, one has to be fasting for this. There is another way, which is by doing a test at any time of the day. And it's a different type of test which is called HbA1c or glycosylated hemoglobin. And this test usually tells you what your average blood sugar has been over the last 3 months. Now there are certain cutoffs for these tests, and this can also detect diabetes. There is a third way, which is usually a lengthier test, and it's called a glucose tolerance test, but this is reserved for people who are being tested for gestational diabetes, and it is sometimes used to confirm the diagnosis that have been done by other methods. Medicines are generally not stopped once it's started. And this is not to say that one gets used to this medication, but it is that this condition is a progressive condition. So at the time of diagnosis, a person has already advanced to a level where diet and exercise would not be enough, and there is no way to reverse this other than to try to protect it from getting progressed further.
Then Pallavi, and this week our expert is Dr. Zain Gulzar, who's a consultant endocrinologist and medical director at the RAK Diabetes Center in Jumeirah. We're talking about diabetes. We've also already spoken about what kinds of diabetes there are. Is there a cure?
Right.
What precautions can one take? But right now it's a very practical question for a lot of people staying in the UAE.
Yes, the month of Ramadan is on, Dr. Gulzar. And what does one do if one is diabetic? Can one really fast during the month of Ramadan?
Well, there is no easy answer for this, so I would say yes and no, depending on the type of diabetes, what medication one is taking, and how well controlled one's diabetes is. So let me give you an example. If someone has type 1 diabetes, the type that requires insulin, and the diabetes is poorly controlled with frequent fluctuations of high sugars and low sugars, then in my opinion it would be dangerous for that person to fast. On the other hand, if somebody has type 2 diabetes, which is well controlled with certain types of medications that would not lead to low blood sugars, then it is relatively safe for that person to fast. Sometimes people will require alterations in their medications. Certain medications can be discontinued, certain medications would need a different time of the day to be taken in order to fine-tune it during Ramadan. But in summary, one should refer to the doctor and advise them, who should advise them on this issue, and this, as this varies from person to person.
Right.
So yes, you're absolutely right. In 1997, the
It
cutoff,
was 140.
the cutoff for diabetes was 140, and there were lots of people who had diabetes who really didn't know it.
Mhm.
And then they had this consensus meeting, and they found that, it was decided that lower blood sugars to a point where one is protected from complications of diabetes would be about 100.
So in 2003 they made it
That's,
100.
yeah, that's
So
right.
again, there was a huge jump in the number of diabetes
Exactly,
patients.
yeah.
ये सारे सवाल हमारे जहन में कूद रहे हैं डॉक्टर एंड डायबिटीज क्या है ये तो हमने जान लिया है बट हाउ इज डायबिटीज ट्रीटेड डॉक्टर टेल अस
So diabetes is treated really by proper diet, regular exercise, and medications.
बाय
And-
प्रॉपर डाइट व्हाट डू वी मीन
Diet that has been prescribed and that is low in sugars, that is given at regular intervals, that should not be excessive on any one of the components of the diet. Like there are three main groups: carbohydrates, fats, and proteins, and they have to be balanced. Exercise at least 30 minutes a day, and that's a combination of cardiovascular exercise and weights and medications. Now, as far as medications, there are several different types of medications. Oral tablets, which again are of many types. Some may cause low blood sugars, others may not. Generally, the ones that cause hypoglycemia, low blood sugars, are the older types of medications, and the ones that don't cause hypoglycemia are considered safer. Again, then there are injections. Now, injections are also of two different types. There are insulin injections, and then there is the newer types of medications which are non-insulin injections. The non-insulin injections are a smarter type of medications that do not result in low blood sugars, and that can help people to lose weight as well.
Our listeners have benefited from this talk, so thank you so much.
Thank you. It was a pleasure. Thank you for having me here.
On SUNO 1024, you're with Anant and Pallavi, and we'll be back with more experts on the show, which is called Meet the Expert. Today, we had consultant endocrinologist and medical director at RAK Diabetes Center in Jumeirah, Dr. Zain Gulzar, and he's told you a lot about diabetes. So make sure you watch your lifestyle, exercise, and watch that diet.